This is Dr. James with HelpMommy.com. And if you have a baby that you are concerned about for any reason, especially if you have a special needs child, like trisomy 21 or a seizure disorder or something big, just remember that it is your job as the parent to be your child's best advocate. You're going to be going to battle for your child, and you need to know more about that disease or that syndrome than anyone else does, because no one is going to have the time to commit to your child and your cause more than you do. I'm going to give you examples. Several years ago, I had a baby born with trisomy 21. I saw them in the hospital, and then they came back to see me about 3 or 4 days after they were born in the clinic. When they arrived, the dad had a 3-ring notebook that was about 2.5 inches thick with information on trisomy 21, what all kinds of therapies there were, what all kinds of different things they could have, delays, everything. At that point, I looked at him and I go, "You have already read more about trisomy 21 than I ever have. What is it you want me to help you accomplish?" And that's what you need to do. You need to become the expert in your child's diagnosis, their disease, their syndrome, so that you know what's out there and everything about it. And then you ask questions and ask for those services and ask for those treatments. And then your doctor will look into it. There's no way that a doctor could be that much of an expert in that one thing. There's too many things that we have to be pseudo experts in. But when you wind it down to, or get it down to just one little tiny syndrome, in the span of a couple weeks, you would have the potential of knowing more than we ever would about that. Now, we might understand more of the intricacies of how things work and how things interact with each other. But as far as what services are available, what grants are available, what monies are out there, what your insurance is going to cover, what all the different types of therapies that are available for your particular child and their needs, you should be the expert. You should be the one that's the squeaky wheel demanding to get the things done, because no one's going to want to help your child more than you will. And so I give you full permission to be that person. And your child, well, your child needs that person. So if you get one of these diagnoses of a syndrome or disease that's a big deal, make sure that you know everything you possibly can and demand the very best for your child. Explore, push the boundaries to get the best for your child, because that's what they deserve.